Uh, Usually, most common cause for the visit to the hospital by any parent or any children is because of the routine vaccination. So during vaccination, a lot of parents will be having a lot of queries regarding the vaccine, why they should get vaccinated, what precautions to be taken after vaccination, how to deal with the pain, fever, swelling after the vaccination, why they should get the booster dose of the vaccination, and what is the relation between egg allergy and vaccination, when they should vaccinate their preterm child, when they should give vaccination after the IVAG, what is the status of COVID-19 vaccination in children. So all these questions will be answered in this live session one by one. So first we'll see like what precautions to be taken after the vaccination. So usually after vaccination, we'll ask any parent of the child after getting vaccinated to stay in the hospital for next 30 minutes to see whether any adverse reactions or any complications develop after the vaccination. In case of any anaphylactic reactions or anything that can be addressed in proper time. So that is a helpful time. We'll be staying in the hospital for 30 minutes. And most commonly during 30 minutes, most of the parents will be asking whether they can breastfeed their child. And so they can breastfeed their child immediately after the vaccination. Even after taking the oral vaccines also, they can breastfeed the child. So other common question they asked by the parents is like how to deal with the pain as well as the fever post vaccination. So during the most of the children's they have the pain as well as the fever after any injectable vaccines. So they can give a small dose of paracetamol according prescribed by the pediatrician. And how to deal with the swelling. So for if there is any significant swelling, they can give the cold compressions for the swelling. So that might be helpful. And no need of applying any ointment or any other material for the over the swelling. And so that will complicate the unnecessary issues. Okay. So these precautions should be taken immediately after the vaccination. So other common question asked by the parents is like why they should give the booster vaccines. So suppose they give like a pneumococcal vaccine at 6, 10 and 14 weeks. So that will be repeated usually at 15 to 18 months of age. So most of the parents will be asking, sir, why should we give pneumococcal vaccine? We already gave to our child around 6, 10, 14 weeks. So what happens is like after giving the initial set of vaccination schedule, the immunity wanes off our immunity diminishes over the period of time. So that is the reason we give the booster doses at a particular time so that the appropriate levels of antibodies are maintained within the body. So other common question asked by the parents is what is the relationship between this egg allergy as well as and the vaccination. So if you see that since the past few years there is a lot of speculation going on in the media regarding media as well as in the social networks sites and all like not to give the vaccines because of the egg allergy, which side will be having egg allergy and all. So usually if we consider in our Indian scenario, the egg protein is the common source of animal protein which is present in these three vaccines like influenza vaccine, Q fever vaccine, and yellow fever vaccine. So in Indian scenario, only the influenza vaccine is commonly used. So this influenza vaccine, whatever it is marketed in India, like from whatever the vaccines available in the commercially available vaccines, they consist of the egg protein which is less than 1 microgram. So this is very negligible amount to cause an egg allergy in any children. So usually, if you go through the literature, the egg allergy affects only 1.3% of any children. So how to identify this 1.3% of the children is like so one useful thing what we usually suggest is like if the child can consume the scrambled eggs without any adverse effect or without any allergy, so then he won't be having any egg allergy. So So whether they can take the influenza vaccine or not. Yes, they can take the influenza vaccine even though they have an egg allergy. So according to the literature, though the whatever vaccines available in the market, they consist of less than 1 microgram of ovalbumin. So they can take the vaccine without any hesitancy. So other common question asked is like whether MMR vaccine has any egg protein in that. No, MMR vaccine doesn't have any egg protein. So usually what happens is like MMR vaccine is grown in chick embryo fibroblasts instead of the egg instead of the whole egg embryo. So it doesn't consist of any egg protein, so it can be safely given. So other vaccines which has an egg protein is Q fever vaccine and yellow fever vaccine. The amount of egg protein in the yellow fever vaccine is 10 times more when compared to that of the influenza vaccine. So any child who is having suspected or who is having egg allergy, they should avoid taking yellow fever vaccine. And if there is a situation saying that banners that to give the yellow fever vaccine, they should visit the allergy specialist and they should take a call regarding taking of yellow fever vaccine. And the other vaccine which has an egg protein is the rabies vaccine. Out of the three vaccines which are available for vaccine in the market, only one is having the egg protein. The other two vaccines are developed from human diploid cell vaccine, so they don't consist of any egg protein and they can be safely given in any kind of child, any child even with the egg protein allergy. So other common question usually which is asked by the parents is like, so my child had missed a few doses of the vaccine and now we came late. So whether should we take the complete schedule right from the starting? The answer is no. So and most of this situation they should we will resume the vaccine wherever they stop, and we will encourage the parents to take the vaccine according to the schedule. And sometimes they will ask regarding the catch-up vaccination, how to catch up vaccination if my child is not taking any vaccination. So usually what we usually do is like this catch-up vaccination schedule will be individualized to for each children. So like if the child presented at 3 years of age, the child presented at 5 years of age or 7 years of age. So the catch-up schedule will be different for each age group. So routinely what we practice is like we give all the inactivated or killed vaccine at a time. So we can give n number of vaccine of inactivated or killed vaccine at a time. And inactivated vaccine can be combined with the live vaccine, but we won't be giving two live vaccines at a time. So we maintain a distance of at least 4 weeks between the two live vaccines. So this is the way we usually complete this vaccination schedule to catch up the vaccines according to the schedule. And the other common question asked by the parents is like, my child is a preterm child, whether they can take the vaccines or not. So, if we consider like in preterm, so most of the children who are in NICU, by the time of discharge, we will be giving the vaccines like BCG and OPV. And regarding hepatitis B, so hepatitis B is usually advised for children who are greater than 2 kgs of age. So if at all it is given for less than 2 kg of the weight, so usually what happens is the immunogenicity generated by the vaccine will be less when compared to the normal children. So that is why we suggest usually to take the vaccine once a child is above 2 kgs of age. So and these preterm children should receive all the vaccines according to the chronological age. So according to the time of the birth, they should take all these vaccine according to the schedule. So this is the reason. And usually during the stay in the NICU, we avoid giving OPV vaccine as well as the rotavirus vaccine, because as they are the live vaccines, there is a high chance that they will be circulated in the vulnerable infants. So that is the reason we avoid during the stay in the NICU, and most of the time the infants will be getting these vaccine at the time of discharge. So this is the thing we have to keep in the mind while giving the vaccination in case of preterm children. And other common queries like because of the recent hospitalizations and because of the recent post-COVID era, a lot of children are suffering from multi-system inflammatory syndrome in children, and many other children like post-COVID illness, Kawasaki disease, and some children will be receiving the IVIG dosage. So after receiving IVIG, when should my child receive these vaccines? So IVIG doesn't interfere anything with that of the killed vaccine as well as any inactivated vaccines or the rotavirus vaccines. So they should be IVIG interfere only with the live vaccine. Say for example like MMR, varicella. So when they should give this MMR vaccine as well as the varicella vaccine after giving this IVIG. So it depends upon the dosage of the IVIG given for the child. So in most of these situations, what I told earlier, they will be receiving these vaccines. They will be receiving this IVIG at a dose of 2 gram per kg. So they should receive these vaccines like almost like 8 to 11 months after completion of their IVIG. So till then, the child should not receive this live vaccine. So what happens if they give the live vaccine for these children? So what happens is that there won't be adequate immunogenicity generated for these vaccines, and the dose of the vaccine will be wasted. So they should be given ideally 8 to 11 months after the completion of this course of the IVIG. And rest all other vaccines like inactivated vaccines, killed vaccines, rotavirus vaccines, all these things can be given according to the schedule. So other common question which were asked by the patient is like, suppose they missed a dosage of a vaccine. So if they came late, whether they can give any vaccines according to the schedule, or they should complete the schedule right from the starting. So what we usually suggest is like to wherever they stopped this vaccine, they should resume this taking the other vaccines from there onwards. And other common question asked is like, my child didn't get any fever following the vaccine. So does it matter, and does it indicate that this vaccine is not effective at all? So no, the answer is no. So all the children won't be having any fever. All the children won't be having the fever after the vaccination. Only few children want this vaccination, and it doesn't indicate that the vaccine is effective or which the vaccine is not effective. So it depends upon each child to child. So these things should be taken. Things should be carried forward in the mind. So, and other common question which were asked by the parents is like, my child developed a severe swelling after developing the BCG vaccine immediately, which was given immediately after birth. So, after BCG vaccine, usually all the children will get some kind of a vaccine or some kind of a swelling or some kind of ulceration, which will develop over the period of time, say around like 4 weeks, 6 weeks, and around 9 weeks. So that thing is normal. No need to worry regarding that kind of dosage, or no need to worry regarding by seeing the swelling. That is a part of the BCG vaccine, and that will be present in almost all the children. And many of the kids, many of the parents, while visiting to the hospital, they demand like, my child, that is only the part of the vaccine, BCG. I don't want the painful vaccine. So what is that? What is the meaning of the painless vaccine and the swelling vaccine? So if you see the DPT vaccine, which was given at the parents while 14 weeks, along with the vaccines and swelling, that is only the part of the DPT vaccine has a purchases component, which has two components. One is like acellular component and wholesale component. So those vaccine which consists of acellular purchases component will have less pain after the vaccination, or when compared to the wholesale purchases vaccine. So it doesn't mean like painless vaccine don't have the needles and there won't be pain at all. So there will be needle and there will be pain even after giving the vaccine, but the pain will be less when compared to that given by the wholesale vaccine. So these things should be understood by all the parents regarding this vaccination. And sometimes in special situations, we do see that some children undergoing this cochlear implants, some children undergoing this splenectomy. So any special vaccinations provided this condition means yes. So those people who had this cochlear implants, they are they are prone for more risk for pneumococcal pneumonias or any meningitis at all. So they should receive these pneumococcal vaccines according to the schedule. And those children who are planned for the splenectomy or removal of the spleen because of their underlying condition and all, they should receive the special vaccines like pneumococcal vaccine, meningococcal vaccine, and Haemophilus influenza B vaccine. So all these things should be given according to the schedule. So already I spoke regarding the catch-up vaccination. So how this catch-up vaccination is planned means like if at all the child comes around 3 years of age, so they have to note down like whether this child is given like previous vaccination of BCG or other vaccines like which are done at 6, 10, 14 weeks. So if the child is not even vaccinated from the birth, so we'll see the schedule like all the inactivated vaccine, killed vaccines are given together, and along with that we'll give one live vaccine at a time. So and we maintain a gap of around 4 weeks, and we'll call for the other live vaccine so that we can complete the schedule as soon as possible. And these children and the parents should be, we will counsel the saying that they should come for vaccination for the regular visit, and they should take all the vaccine according to the schedule from then onwards. And a lot of queries are coming regarding the COVID-19 vaccination in the children. So that is also a lot of speculations going in the media since the past 2 to 3 months, when Drug Control General of India approved the vaccine for emergency use in children between 12 to 18 12 to 18 years of Zydus COVID vaccine. Okay, so this Zydus COVID vaccine has an efficacy of around 67%, and this was approved only for emergency use in these children. So these children, so those children who are having the comorbid features like obesity, or they are having the bronchial asthma, they are at risk of COVID, and there is a risk of more severe infection. So these children should receive the vaccine as soon as possible. And whether this vaccine is available in the market present, the answer is no. So this is not available at present. So they may be available in the following weeks. So other vaccine, which is a lot of speculation, is a Covaxin, whether it can be given in children between 2 to 18 years of age. And a scientific committee had advised for DCA saying that this vaccine can be given for the age group between 2 to 18 years of age. But there is no, trial data, or there is no approval from Drug Control General of India, and there is no clear-cut guidelines from the government saying that these children can be vaccinated with COVID-19 vaccine. So we are yet to follow with the regarding the guidelines and regarding the further dosage of this vaccine, and how when to give and what type of vaccine to be given for these children. So at present, there is a lot of speculation regarding the Zydus vaccine as well as the Covaxin, and most commonly the probable following weeks they can come for the children. So most of the time these common FAQs will be asked by the parents, and almost all the parents will be asking like what happens when my child didn't receive the particular vaccine at a particular time of age. So if you come for late vaccination, any other problems will occur. So the answer is no. Like if they come for the late vaccination, also the dose of the vaccine should be completed as per the schedule. So